Hi, today I'm very pleased to present to you Padmasri Dr. Venkatram Chitta, who, after graduation from Usmania Medical College in the 1970s, immigrated to United States and has served as a professor and continues to serve as a professor at University of Texas Southwestern Medical School in Dallas. And he moved back to Hyderabad, India, several years ago to be the Chief Academic Officer at Apollo Group of Hospitals, and also he is Dean of India Campus of Macquarie University of Sydney, Australia. He has held many leadership positions in the area of a very common topic, hypertension, and is a well known expert worldwide. He has got over 400 publications and 9 books to his credit, and we are really fortunate that he has given time for us to talk about this very common topic. Dr. Ram. Good morning, Dr. Chitta. How are you?
I am fine, Kalpata. How are you doing this morning?
Thank you for giving time for our audience to talk about a very important topic that is a common topic wherever you go. You hear friends, patients saying that I'm a BP patient or I have blood pressure. What exactly is it?
First of all, I am happy to have this dialogue with you. As you correctly said, it's a very important topic globally, not just for India and US. And as you said, many people say that I'm a BP patient, I have high blood pressure, etc. But once the blood pressure is above what is supposed to be normal, it causes a lot of complications, a lot of disease, and also decreases life expectancy. So it is a most powerful and common risk factor for developing a disease in the future and also for decreasing the life longevity.
I mean, it kind of amuses me sometimes when they say I have blood pressure. You have to have blood pressure to be alive. And in the field I practice in, most of my problem is having very low blood pressure that we're trying to rise. So, what are some of the numbers? I mean, what is normal? Is it different in different countries? And
Okay, it's very common for our patients to say that I have BP, and you're correctly right, everybody should have BP. But when the blood pressure exceeds what is necessary for blood to flow, it can cause significant damage to the brain, heart, and kidneys, and can cause chronic disease and disability that could impact not only the patient's life but also of the family and the community in general. You asked what is a normal blood pressure. Now the definition of blood pressure globally is coming towards an agreement that anywhere you live, irrespective of your age, gender, or racial background, the blood pressure normal should be close to 130, the top number, and the bottom number is 80. In the past, it used to be 140, the top number, and the lower number 90. But now there is a reasonable agreement that it should be close to 130 over 80, the top number 130, the bottom number 80 or less, irrespective of your other characteristics.
I mean, you have been in top leadership positions in the field of hypertension and cardiac disease, and you have traveled the world. And how common is it in different parts of the world?
Uh, it the blood pressure, the way I have defined, higher blood pressure, or also known as hypertension, is more prevalent according to World Health Organization in low and middle income countries. The World Health Organization has a social demographic definitions of regions depending on the income. People living in the low income and middle income countries appear to have more numbers of people who have high blood pressure. But it does not mean the developed countries like Europe, UK, USA are anything less. They're slightly less, but there is also very high number of people who have high blood pressure, basically in all countries, more so in some countries.
Um, it's also called a silent killer because people may not know that they are suffering from high blood pressure. What are some of the early signs, or how does somebody pick it up? Do you just go to the, what are your recommendations?
Yeah, it has been called a silent killer for a long time because one can have high blood pressure for a long period of time before it causes any symptoms or before the person becomes sick. And you can have it for many, many years with high blood pressure, and suddenly it erupts like a volcano and can cause serious damage to the brain, heart, and kidney. So the best way to prevent these complications is to detect high blood pressure before it causes complications. And the only way to know whether you have high blood pressure or not is to have it measured either in the doctor's office or in various ways, any healthcare professional or the blood pressure measuring kiosks are there. So that is the only way to know whether you have high blood pressure or not. But you should not depend on symptoms to tell you that you have high blood pressure.
Now, that's a very, very important point. And also, the blood pressure being high is also different with different age groups as well as pregnancy and so on. I just wanted the audience to know that.
Okay. One myth that I would like to resolve is that aging individuals, elderly people, definition age 60 or 65 or higher, for a long time it was suggested that elderly people should have a high level of blood pressure to maintain their circulation, but that is absolutely wrong. Now the blood pressure should be the same, normal for all age groups, irrespective of the age. So even if somebody aging and high levels of blood pressure, that is not to be considered as a normal accompaniment of the age. In those individuals also, the blood pressure should be diagnosed and should be treated as you would in other age groups. The second thing you mentioned is in pregnancy. In normal pregnancy, the blood pressure falls. Actually, the blood pressure goes down in normal pregnancy. If the blood pressure does not go down, or if it goes high, and that can cause serious problems to the mother and to the baby. Therefore, even a slight increase of blood pressure in pregnancy is a very serious sign that unless it is treated, the mother and baby could have complications.
I think you brought up a very important point because you meet older individuals and they say, at my age, it's okay. You brought out a very important point that it should be controlled at any age. Um, what are some of the ways that you can, you mentioned blood pressure kiosk and, going to doctor's office. I mean, most of our, especially in India, 65% are young people. So they will never think that something like this, diabetes, hypertension, all of these would affect them. So how would you say, it doesn't mean that they don't have it. So how do you suggest, do they get yearly physicals? What's your recommendation?
Okay, now not just regional, global recommendations are that for every adult ages 18 and above, the blood pressure should be measured once or twice a year for sure. In fact, the new recommendation from Europe suggests the blood pressure should be measured after the age 6 also, but that is not practical. Countries like India and China have a large segment of the population which is relatively young. And unfortunately, both China and India are experiencing very high numbers of high blood pressure or hypertension in younger individuals. And that is a matter of great concern because if young people do not have their blood pressure detected or treated, they are not likely to live as long as their parents or grandparents.
Dr. Ram, what's the goal of blood pressure when you are treating, and how fast should it come down if it's very high?
Okay, the blood pressure goals, fortunately, are also getting a common or unifying agreement. For most people, the blood pressure goal should be 130 top number, 80 bottom number, with few exceptions. In some elderly individuals who are very frail and who have difficulty in walking and who are not independent, probably in those individuals the blood pressure goal should be individualized and should not be made as normal as you would in healthy elderly individuals.
Um, Also, how often do you recommend like the end organ damage to check for that, like kidneys and heart and so on?
Okay, the once a doctor or a healthcare professional makes the diagnosis of high blood pressure or hypertension, then at that time it is required to what is known as to have some baseline numbers such as ECG, blood test for kidney function, and some tests for heart function, routine simple tests, not very complicated. So a blood test, a urine test, ECG or echo, these have to be done in every individual who has been diagnosed as having hypertension, because that tells you where you're starting, and it also tells you whether any of your target organs in the body have already been damaged.
There are also so many blood pressure measuring devices that you can do at home. Do you have any recommendation?
Now, there is a strong emphasis on measuring blood pressure at home, and a number of devices are available which use a standard technique of measuring the blood pressure with any of the home blood pressure machines. In the past, the standards of home blood pressure machines were highly variable and some of them were not dependable. But due to the current technology of instrumentation and standardization of instrumentation worldwide, most of the blood pressure monitors that with which you can take blood pressure at home are generally reliable unless there is a reason not to believe them. So I would strongly advocate using any home blood pressure machine if you want to check the home blood pressure and also notify the doctor accordingly. They're pretty much well standardized and calibrated and reliable at the present time.
One other point is what is the relationship between snoring, sleep, and high blood pressure?
Okay, one of the things that has now been accepted is a condition which Kalpata you know, obstructive sleep apnea, where patients for this condition, obstructive sleep apnea, for this medical condition, one of the symptoms is heavy snoring. People snore, and then they stop breathing for a while and they snore again. And when people have this kind of cyclical breathing pattern of snoring or not snoring, it could cause an increase in blood pressure. And the obstructive sleep apnea or snoring associated sleep apnea is more common in people who have excessive weight than people who have normal weight. So if somebody who has obesity, excessive weight, and has significant high blood pressure, perhaps it is important to make sure that the person does not have obstructive sleep apnea, which can be easily diagnosed and which can also be treated.
In fact, one of the early changes that happens is the normal variation of blood pressure during sleep goes away when you have, and it's a very important point that sometimes, especially in India, they're not even that obese,
Right.
and there are a higher percentage of people here compared to US who are not even obese but have severe OSA. So that's a very important treatable and preventable factor.
Yes.
Yeah. One common question that the audience always have is there any way, I have seen even young people say that, oh, I'm going to control my blood pressure, I'm going to run and I'm going to stop eating salt. Somehow, some of them are mortally afraid of taking any medications and they keep coming back with symptoms. What's your recommendation, like lifestyle modification?
Yeah, of course, particularly young people are more motivated or more interested in wanting to control the risk factor by hygienic lifestyle, regular exercise, balanced diet, low salt diet, etc. But even when you're following lifestyle changes, it is important to have your blood pressure measured. Lifestyle changes are important, but many people, despite lifestyle changes, continue to have high blood pressure, high cholesterol, and diabetes. So lifestyle changes are important, but at the same time, it does not take you away from a healthcare access system. You still need to see a doctor or a healthcare professional periodically to make sure that your lifestyle changes are controlling the risk factors. If not, you will end up in appropriate treatment. One of the things that people do due to widespread publicity is to maintain a low sodium diet. Uh, Organizations now suggest that the normal intake of sodium, medically sodium chloride, should be less than 2 grams per day, 2000 mg per day. Uh, Studies have shown in countries in South Asia, particularly in India, the salt intake is 8 to 10 grams or higher. So the first step would be to reduce the salt, but reducing the salt reduces the blood pressure only in some people, not all the people. It is not a guarantee. That is the reason why you should still be under the surveillance of a healthcare professional to make sure that it is working. If it is not working, then there are other alternative approaches to regulate the blood pressure. One thing you mentioned about young people is India has been identified as one of the highest risk countries for young people to develop heart disease. It has been suggested, compared to developed countries, young individuals in India are at a 40% high risk of having premature or early heart disease. It's very common in young people in India, unlike the Western world. I will tell you one instance in India. When you take a history from the patients, that is done medically. When I take a history from patients here, particularly in India, when asked, is there a history of heart disease? And the individual will raise the hand and says, yes, my son had a heart attack. This is
Yeah.
quite opposite of what you see in the West.
Yeah, very important point. One of the things in the diet is also, I mean, naturally the vegetables, everything we have some natural salt, and I think the junk food has caught up very much here as well. When I see like all the chips and all the fast foods and pickles, and where you have no control of how much salt you're taking in.
Right. That is probably responsible for increasing numbers of people with high blood pressure in developing countries due to expansion of middle class and availability of fast foods at any time and in close proximity to where people live and work. And it has been suggested this could be a contributing factor for high levels of blood pressure. There are studies done in India in major metropolitan areas which have shown that even high school children who have access to fast food appear to have higher levels of blood pressure compared to those who don't have access to fast food in rural areas.
So, in summary, your recommendations are what, for prevention, lifestyle, how often you check, with what do you check, what would be your summary points?
Since high blood pressure is a silent killer, the only way one knows about the condition is to have it measured. Either in a doctor's office, hospital, anywhere, it has to be measured. And if it is high, it has to be measured again to be certain that it is really high. Once the blood pressure is high, then you should be under appropriate treatment, which could be lifestyle changes, followed by, there are wonderful medications now which don't have that many side effects that can be given to bring the blood pressure normal. And that is very important that there are now availability, besides lifestyle changes, various drugs are available, usually in combination that reduce the blood pressure to the levels that you need. So that is not very difficult at all. I'll give you one statistics. In India, for example, it has been estimated nearly 300 million adults have high blood pressure.
The population of US.
Population of US, and these are all well documented and well studied clinical trials. And in year 2018, which is the last statistic we have, in India, we spent about 80 billion US dollars annually to take care of individuals who have high blood pressure or its complications. So $80 billion a year. And now we have 300 million people who have high blood pressure, and these numbers really have to go down. Otherwise, we may have a big tsunami of cardiovascular disease in the future.
I think, as I come here, you will live, even now you live on both sides, US as well as here. You practice in both places, so you have a very good comparison. And, I visit twice a year at least, and I see all these young computer professionals. I'm very proud of them. They really back office of the world. But the point you made is we are at a high risk for heart disease. Young people are having high blood pressure. Some of them are reticent. They're sitting at desk. They're not moving too much. So the risk of all these heart disease, hypertension, obstructive sleep apnea, all of these increase. So I think we have to say to India, take care of yourself. And the stress levels associated with these jobs is also very high. So
you're absolutely correct. In fact, there is at least in major cities, there is a move towards having a small clinic or a healthcare professional at the place of work. In large technology companies, now there is not only a blood pressure kiosk, but is also a small clinic with a healthcare individual where people can go and have their blood pressure measured. And that is a step in the direction. And a lot of manufacturing plants are also setting up facilities where the blood pressure and diabetes and cholesterol can be measured at workplace and be followed. And that is in the right direction we're going.
Excellent. Thank you so much. Thank you for giving time.
Thank
Namaste.
you. Thank you for asking me to participate in this dialogue.
Thank you.
Bye-bye.